truly and truly, I think in many ways addressing disparities in our communities. And so I just want to say that because I think you're going to hear me come back to that in different ways quite a bit today. So I like this quote by C.S. Lewis, who says that what you see and what you hear depends a great deal on where you are standing. It also depends on what sort of person you are. And as I think about that, I think, even I'm not as connected to Mecca at this point as I was many, many years ago. Was one of the original few individuals who sort of launched the organization many, many years ago. And what I knew then and what I knew all along the years that I was more intimately involved is that even within our own cultural communities, we have perspectives about ourselves, perspectives about the other communities in Mecca that we're working with. And so I think it's important for us that we kind of, as we think about what it means to come together to provide and deliver services as a collaborative of multi-ethnic community, cultural communities, what does that truly mean for us? What does that truly look like? How do we, in some ways, really truly come together, understand who we are, know what biases and assumptions that we might bring to the work that we're trying to do, and know what assumptions and isms we might have, especially towards older adults. You'll hear me talk about this in just a little bit, but there's a lot of isms that we talk about: racism, classism, sexism, heterosexism. And ageism is important when we talk about older adults. It has a lot to do with how we, in this particular US based cultural context, understand ourselves, understand the aging process and what that looks like in many ways. And ageism is really interesting because it's one of those, what some people might call an oddism. And that is, it is still in many ways socially acceptable to sort of comment and remark about people's age and older adults in particular. We're having discussions now around, the next president of the United States, and I won't get into the candidates themselves and the politics of that, but there's questions about both and their age and their cognitive capacities, and I think we're having those discussions, and I think those are ageist discussions in many ways, and I think that's problematic in some ways. I think we're looking at it as that there's an issue or a problem with that, and I'm not sure that that's the case. I think how we even think about our older adults in our communities and the work that we're doing and each other from our own cultural lens absolutely matters. This African proverb, I know the word elderly is not always socially acceptable to use. I left it here for the integrity of this particular proverb, but I think when we think about older adults, our elders in our communities, this African proverb I think really sums up for me what's so important. It's a village without the elderly or the older adults and the elders in our community is like a well without water. And I think we have to kind of, I think, reframe and think about our older community members in our families and our communities in different ways. And so I want to help us shift a little bit some of that. As I think about this idea, Eric Erickson, has talked about this for a long time, or talked about this a long time ago. This idea, this fear from within Western communities and cultures of aging, this fear of getting older, which oftentimes keeps us from living our lives fully. You're going to hear me talk about this later, but capitalism needs a market. It needs to sell. When we talk about getting wrinkles or getting gray hair, I mean, for those of you who know me for a while, I'm graying. I'm graying a bit, and hey, I'm cool with that. There's nothing wrong with that. But within Western culture in many ways, within US based culture, there's a lot of fears around aging in some ways, of getting older and what that means. And I think when we talk about, so it impacts our ability to have this conception of a full life. You'll hear me come back to this later, but in Japan, it's one of the communities where folks are living the longest, and there's been research that has been done in Japan and kind of looking at why that is in many ways, and it's because the reverence and in Japan they have a word for getting older, and it's almost like it's like a reason for being, a reason for existing, and it's like a rebirth. It's like there's a transition, there's a rebirth. Many of our communities, I think, perceive those processes in those particular ways, but we also have different values here within a US based, I think, context, around even this idea of individualism. Many of us come from community, more collectivistic, community based mentalities and cultures. And in the US, we combat this individualistic, capitalistic pressures and that I think oftentimes change who we are culturally and as families in many ways. There's a lot of research that has demonstrated for decades now that when we first immigrate to this country, if we're born in another country, we come oftentimes more healthy than the longer that we're here. The longer we're here, the earlier we come, the more healthy we are. And then as we stay here longer, the more unhealthy we become in many ways. And so there's something to be said around the impact the impact that has in our children who are born here. There's research that has been done that shows that while our first and second born here in the US might have more financial resources and access to resources, we're living shorter lives than our parents who maybe immigrated or and our older elders and our older adults and elders in our community. So we have to pay attention to that. I think, there's a need to address and understand the cultural attitudes, and to increase investments in programs and services that support the health and well-being of older adults. That's why the EISOA program or the IOS, I think the acronyms change, but the program where we're sort of serving our older adult communities is so meaningful and so important, because we need to do that more. And so if you look at this, even on this slide, I just have some different examples around just how different communities understand our elders, our older adults. And so older adults are often respected in many communities, as many of you know, and death is not necessarily seen as the end of life, but as an opportunity to celebrate life in a new birth in some ways. And so we can't fit a square peg into a round hole. And I worry that oftentimes when we try to develop programs and interventions and services, that they are often operating from a lot of assumptions. And I'm going to get to those in just a few minutes, but a lot of, assumptions around the folks that we're serving and their capacity to receive those services. I think even in our best attempts to make services accessible, sometimes they're inaccessible. And so we want to meet communities where they are, as I think Mecca that's been a value of Mecca for so long. Meeting folks where they are, it is so important. We try to fit people into fit the square peg into a round hole. We have to chip away at aspects of their identities, their cultures, their language, their lived experiences to fit them into something that maybe they're not. So we need to be careful about that. And we need to push back when people are asking us to do that with the communities that we know best and that we serve, and we know best what they need. And so there's lots of research and lots of data that supports this. I'm not going to go into tons of demographics because I think demographics are the easiest thing for people to go and find and look up. And I think Mecca does a great job of pulling this information together. I just have a few here that I'll simply highlight just to give you some background information. But look, we know that our population is getting older. Some data says 82 million by 2050. Some says 1.222 billion. I don't know what what that's going to look like. But it's increasing. It's increasing. The number of U.S. Individuals here in the U.S. ages 65 and older is continuing to increase dramatically. Our U.S. population today, that's including our foreign-born immigrant community members, et cetera, is older today than it ever has been. And then, the number of folks who identify as non-Hispanic white is going to drop pretty significantly over the next 30 years or so. So there's definitely we're getting more diverse as well, and so the diversity of our older adults and just even our younger community members is just growing exponentially, and so we're gonna have to address that, and I think that's why Mecca is so primed in many ways to be able to do that in different ways for different reasons. And then, we have economic disparities that are also found across different, population subgroups. So we know that when we intersect, ethnic and racial issues with class issues, we know that the disparities are significant for many communities of color. So we see that oftentimes, with our Black and African American and many Latinx and immigrant communities, oftentimes even beyond just Latinx communities, but immigrant communities more generally speaking, who are living in poverty. And that's more than twice, in some statistics, more than three times the rate of those who identify as white-bodied individuals, which is I think a concern. And I think obviously we see that here even in Orange County. More older women are living alone. And I think there are disparities and attitudes and perspectives that I think contribute to that. And I think we have to pay attention to that as well. There's also many older Americans face a caregiving gap, especially those in lower income communities and those who may have, early signs of dementia and full-blown dementia. And so I think the need for caring for older adults is going to continue to increase as well, as we kind of move into the future. But there's disparities. There are disparities between the ability to meet the needs of our older adult communities and communities of color than our non-Hispanic white-bodied community members at this moment in time. COVID has become one of the top leading causes of death in the United States for older adults. I think cancer and heart disease are the other two. I think cancer being the number one, heart disease being the second, and then COVID-19 being the third. You're going to see different data levels from different statistics and different databases, but some I think really noteworthy other things to be mindful of that I think we don't talk about a whole lot is that our older adults' education levels have been increasing over time as well. So in 1965, there was about 5% of our older adult community members had completed 4 years of college or more. If we look at last year's data and statistics, which I think is the most recent one that we have, that number had risen to 33%. And so so our older adults are more educated, which I think leads to the other bullet points on here that they're also working longer than they used to, and that number is going to continue to increase. I don't know if that's a good thing or a bad thing. I think if people are making the choice to want to work, then they should have that ability, because I think ageist perspectives oftentimes prevent people, older adults, from getting jobs and being sought out as viable, legitimate candidates for jobs. And so I have an issue with that. I also think that we work too much here in the United States, and we which is not healthy for us. I think we sort of sometimes are working to just sort of meet daily needs, and I think there's a disparity there that I don't really like. But having said that, I think older adults should be given more opportunities to work, and I think that's happening when they're making those decisions based on data and statistics. Poverty rates have also dropped a bit. Now, when we look at the poverty rates across the board, it looks like it's dropped. When we look at the poverty rates with particular communities of color, that still hasn't made too much of a dent or a gap as much as I think there needs to be. So data and statistics can be a little deceiving sometimes as well. But we know that for some older adults, the poverty level, they're no longer living in poverty. But when we break that down and look at particular communities of color, we see that there are some pretty significant disparities than there used to be. And then more older adults can meet their daily needs. I think that has a lot to do and intersect maybe with education level, with the ability to continue to work, being able to take care of themselves in some ways. As I think about it, I mentioned capitalism and all these kinds of things. It's important. It's important. But I don't know of any other place, although I'm embedded here in the US, and so if there's other places you can tell me. But what I find fascinating in the US is that we sort of extrapolate all the nutrients from foods and herbs and plants, and we try to sell them to everybody to take care of themselves for thousands and hundreds and thousands of dollars. We've culturally appropriated practices that indigenous and other communities have been doing for generations, and we are repackaging them and selling them back to ourselves, and then they become inaccessible. It's like we're people have to like take all these supplements that are coming from the natural foods and plants and herbs and things that are many in our communities and have been using for generations to take care of themselves. And so we have to think about those things. Colonialism and capitalism kill creativity and compassion. And so we have to be creative as we think about the work and serving our communities, because colonialism kills creativity, imagination. And so how can you, as staff members, be imaginative and creative in doing the work that you're doing with the communities? And so as we look at the social determinants of health, which I'm assuming many are familiar with, but those conditions and environments that people are born into, grow, live, work, et cetera, are crucial to shaping one's overall living conditions and well-being in many ways. And so um, there's the economic stability, social and community context, all these different areas that I think are so important for our community members. Here in California, if you look at the California poverty measure, if we look at economic stability, the California poverty measure, there are some groups in California that have higher poverty rates than others, and when you look at those, the ones with the highest poverty rate are those undocumented immigrants, the immigrants that don't have a residency or citizenship here in the U.S. Are often found with the highest rates. Many who are the communities that you're serving. A second high population of those who are born outside the U.S. and who've immigrated to California. High levels of poverty. Those without a high school education and diploma, high levels of poverty. People with disabilities, high levels of poverty. So these intersect with many of the communities that you are working with, and so that that impacts social equity, and that impacts health outcomes in many ways. And so when we look at the social and community context, social isolation and loneliness, as from the work you're doing in the program, are higher risk for dementia and other serious health conditions. While having positive social relationships can help people live longer and healthier lives. And so looking at education and access, some of the data suggests that about 8 in 10 older adults may struggle with even completing medical documentation and paperwork, that going through all these systems that they have to go through, which is just daunting and overwhelming. And the ability to learn how to access and navigate and advocate for themselves, I think are privileges that many of us may take for granted. But those are issues that make it hard for our older adult communities and some of our communities of color to make good informed and well-informed health decisions. If we look at health access and healthcare and access quality, you know, um, our healthcare system, and you're going to hear me talk about this again, but it's a crisis management system, not a prevention and early intervention system. And I think that's part of our issue with our healthcare system here in the US. And so, we know that, most older adults in the US have at least one chronic health condition, which impacts, which affects access to affordable health care, maybe sometimes high out-of-pocket cost or no access at all. Medicare often, can complicate access and, care for older adults. And so there's a lot of issues with there. And then I think neighborhood and the environments we live, as people get older, our mobility decreases. And so access to, you know, places and neighborhoods and homes and wherever they're going are obviously hugely important and impactful. And then if we look at just I mentioned some of these, but we know that stronger social connections are going to decrease risk of heart disease, stroke, dementia, and depression. We've seen that with the program that you're running. Transitioning from employer-sponsored health insurance plans for those who are working and have had that ability to Medicare and other are no plans can be obviously devastating. And so that there are a lot of implications here. When we look at our systems of care, our systems of care, including our healthcare system, assumes a lot of things. I think, it assumes resistance or lack of investment and interest in oneself when we have to miss an appointment or can't make an appointment, can't access an appointment. Our healthcare model in particular, and most of our systems are built on a middle class model and values. And so most of the systems that many of our community members are trying to access were not built for them. Many of them built them, but they weren't built for them and with them in mind. Our systems of care, including our healthcare system, assumes we can take off work for care, assumes that you speak English, assumes that you're literate, assumes you have a working telephone and accurate address or a consistent address, assumes you have a steady supply of basic needs, including food and water and other basic necessities, assumes you have a home. There's a lot of assumptions that our system makes. When you think about the assumptions, those inherent assumptions, it doesn't seem very accessible and realistic to reduce disparities. And when we look at how much we've reduced disparities, it's very little actually, when you look at the data. And so, as I mentioned, our current healthcare system is a disease management system, not a prevention one. And so when I think about this, what we don't think about and our underlying assumptions in some ways, I think about that we are in the US in many ways a throwaway culture. We have become more and more a throwaway culture, a culture that conditions people to wait for what's coming next. A culture that even within my discipline of psychology, it's like this idea of like, what's the next best intervention? What's the next best evidence-based therapy, the treatment, the bells and whistles. I want the shiny objects. I think we get seduced with shiny objects and bells and whistles, and we are forgetting, I think, oftentimes in many ways the things that are most important and matter most, and that is the humanity of the people we're serving. We easily tire both of what was and what is, living with this expectation of what's to come, what's going to come next. We oftentimes think of what went before us as old-fashioned or outdated. And I think when I'm saying this, I'm also talking about people. People. We throw away people. We discard people. We devalue, we dehumanize people. And I think our older adult community members oftentimes may be on the receiving end of some of that at times. In many ways, we are as connected and more connected than we ever have been, and yet we just have less social connections and genuine and authentic relationships with each other. So when you think about that, it's really interesting. You know, our highly technological culture looks more to the future for answers than than it does to the past. And so the version to come will be more vigorous, more effective than anything that has ever come before it, even though when we really think about it, it rarely ever is, and that there's challenges associated with it as well. So I want to combat this throwaway culture. And so what is, ageism? Ageism is this discrimination against older adults because of negative and inaccurate stereotypes. And it's so ingrained in our culture that we don't even notice it. The isms of the world are just part of the air that we breathe. And so, we know that about 90 from some data and research that 93% of um, older adults have experienced some kind of harmful stereotype, prejudice, age-based discrimination, which are all forms of ageism. And it's still, as I mentioned earlier, it's like this like socially acceptable in so many ways. Pay attention to the comments, the narratives that we talk about. Older adults encounter age discrimination, self-perceptions about their aging, internalized negative beliefs about old age, and the biases that people hold about old age that we carry with us. If we're not intentional about filtering the air that we're breathing, if we're not intentional about filtering the isms that we're breathing in, then it is highly likely that we are perpetuating and even sustaining the very things that we are trying to work against at times. So where do you stand? What is your positionality? What is your location as you think about these issues, as you do this work? We know that age biases, it's harmful for our physical, emotional, and cognitive health. It's well documented in a lot of research. Oftentimes, what's really interesting is that the attitudes that underlie age bias and ageism are often rooted in falsehoods and outdated ways of thinking. So we know that yeah, while it's true that there's some risk for the development of some chronic diseases and dementia that may increase over time, most older adults, when you look at the data, maintain quite good health and cognitive functioning. Um, in many ways, aging is a very diverse process, and so there are great differences between individuals. And there's a lot of data that oftentimes shows that it's not necessarily the aging process that is problematic, but it's the attitudes about aging and the internalized ageist perspectives that we begin to sort of believe about ourselves that impact ultimately our outcomes at the end of the day. There was a study that was done just a couple years ago that found that older adults in many instances showed that they were better at orienting their attention and maintaining attention and ignoring distractions and being able to focus even more so than the middle-aged adults that they were in the study with. And so the ability to be able to maintain focus and concentration actually increased in many ways. There's been a lot of research done in Japan, which I mentioned to you previously as one of those places where there's the longest lifespans in the world, actually. And one of the first things that research has documented is just how the differences in how differently older adults are treated there in Japan. And they're sort of celebrated in their families on TV shows, comic books. We know that negative beliefs do have worse outcomes with regards to health outcomes. And so research has also demonstrated that there's the pervasive and institutionalized nature of prejudice against older adults for quite some time. We know that the expressions of ageism can vary across cultural groups and societies, as well as respect for older adults. Ageism is basically prejudice against our future selves when you really stop and think about it. I mentioned this earlier. Capitalism needs a market. So it's like when we start talking about wrinkles and drooping skin and all these other kinds of things, like the far the there's markets that are billion-dollar markets that are making money off of the narrative that are being created to sort of address these issues. So ageism is a global human rights issue. So what can we learn from our elders? And I want to give a couple of examples of some what I think are really important. I think what I would say, different ways of thinking about this that I think are so important. And so what we know is that there's sort of this U curve of happiness, if you will, which is sort of this also known as this paradox of aging in many ways. This is some research done by sociologists and gerontologists, and what we find is that there's this sort of like this U curve here where it's like as children we report high levels of, for many, not all, high levels of happiness, and then middle age we sort of declines a little bit. There's life becomes and looks a lot different in many ways. There's a lot of responsibility, whatever maybe, and then as we age we actually are reporting greater happiness and life satisfaction sometimes compared to younger more middle-aged folks at that point in time. And so it's called this U curve of happiness, or this paradox of aging, if you will. And elders in our communities are teachers, storytellers, protectors, and healers, and critical in many of our communities. Many of our communities see our elders as holders of knowledge and wisdom. Aging is not necessarily a problem to be fixed or a disease to be cured. It's a natural, powerful, lifelong process that unites us all. And then in Sardinia, in Italy, it's a place with the highest, I think, inhabitants of people who are over the age of 100. And there was a book that was done. It was by Butner, who it's called The Blue Zones. This there was like lessons from folks who are living longer. The people who've lived the longest on the planet, and so what this author found in going to Sardinia and studying the communities there is that, like in Japan, the communities there, the older adults enjoy this special place in the community. So the attitudes, the narratives around aging and older adults is totally different than what we oftentimes see here in the US. And so the older you get in Sardinia and in places like Japan and in places of many of where your communities and where you are from, the more social equity people actually have, the more wisdom that people are celebrated for. And so as what's really fascinating about this though is that it's not just good for the older adults, it's also good for the next generation, our children. They call it the grandmother effect. And so what they have found in some communities, and particularly in Sardinia, is that that this grandmother effect, the ability to be sort of continue to have a sense of purpose, a rebirth, a reason for existing, caring for and taking care of our children, lowers rates of mortality and lowers rates of diseases at the end of the day. And so that's powerful. Many Asian communities, continue to believe, as many of that older adults have a great deal to offer in our communities and impart wisdom in many ways. There was a study that was done, and I think it was back in 2011 or so, 2012, and I mentioned Japan, and there was a study done that looked at how Japanese communities looked at sort of the transition to older adulthood as sort of this like spring, this rebirth after a busy working period and raising children. And so there was still a socially valuable part of the life at that moment in time that I think was so powerful. In our what I worry about here is when we immigrate to the United States, the longer we live here, we lose sight oftentimes of the value of our older adults. We become fixated on working, financial gain, that we dismiss, I think, oftentimes the importance of human beings once they've stopped being quote unquote productive. And I think we have to revisit this idea of productive in the workforce, and revisit what that means, and sort of really kind of think about that Japanese philosophy of reason for being. How can we see and transition a rebirth, and how can we help our elders and older adults see that as well? There was some research that was done, in looking at Asian Americans, older adults here in the U.S. And they found that social connectedness, social isolation, number one, was sort of one of the most significant findings, to sort of impacting health and lowering one's social capital, if you will. So remember, in these countries like Sardinia and Japan, the older you get, the more social equity you get. When we look at data here in the US, the more social capital you lose, unfortunately. And that's across many cultural communities as well. And so, one of the things that they looked at was that, how can we sort of combat that and revisit that in some ways? And so it was around social connectedness, sort of finding ways to keep our elders connected to and continuing to contribute to, our daily livelihoods, and increasing access to health services, eliminating language barriers, and other economic barriers in many ways. And so we see this happening in a lot of different communities. There's been research done with Latino communities, and the connectedness within families, and the more connected and valued they are in our families, the lower loneliness and social isolation, which has better predictors to overall health and mental health practices. So there's a lot that we can use and learn here. And so one of the things I would say is that there's this program in Africa. I want to play just a quick slide of it, a quick segment of it, just so you can hear about it. I thought this was powerful. It's called the Friendship. Let me see if I can open this here. Here we go. Oh, it's not going to show. Let me see. Can you see that? Okay. Yeah. Okay. Uh, I'm going to play right here. Self. So I just wanted to show that, to give an example of a of a program that, I think is really powerful. What they in this program, what they have found is that the grandmothers actually are, helping folks even more so than the doctors are. And so, I think that is, what they found in some of the follow-up research too, is that, um, 6 months after receiving treatment from a grandmother on the friendship bench, the folks were still symptom free, and that, they found that, obviously the effects of what traditional doctors were trying to do were not as effective. And so, I think there's something there that we need to pay attention to. And the story of Erica was just one of his patients who he had seen, and was just kind of ending that example. So that really wasn't the crux of it. It was more this piece around the training of grandmothers, and the wisdom inherent there. And so I think there was also another study that was done. So I think this friendship bench study was what, this work was published in a journal as well. Obviously, it's a TED Talk. But so there's I think how we shift this. How can we use this to be creative and imaginative, and continue to find purpose in our the wholeness of our life, the livelihood of our community members. And so there was another study that was done, in an article published just a couple of years ago, where they paired, they called it an intergenerational intervention, where they paired high school students with older adults. And they found that the youth who participated in this study showed improvements in their attitudes, and their attitudes towards life, attitudes towards older adults, and their sense of life purpose in many ways. So there's something around the wisdom that we really can pull from our community members. So as I think about this, I want to end with another clip. I might have to, let's see if this will work without me having to do much here. Let's see. I want to end with this. I know I'm running out of time, so
Clearly, somebody in this room murdered Lord Smythe, who, at precisely 3:34 this afternoon, was brutally bludgeoned to death with a blunt instrument. I want each of you to tell me your whereabouts at precisely the time that this dastardly deed took place.
I was polishing the brass in the master bedroom.
I was buttering his lordship's scones below stairs, sir.
But I was planting my petunias in the potting shed.
Constable, arrest Lady Smythe.
How did you know?
Madam, as any horticulturist will tell you, one does not plant petunias until May is out. Take her away. It's just a matter of...
all right. So did any of you notice any changes in the scenery? If you did, put the number of maybe anything you noticed, any changes in what was happening in that particular scene. Anybody notice any changes that happened throughout that a couple of minutes there? Or actually, yeah, maybe a minute and some change. The night, okay, Matt, yeah, different, that changed, okay. So that's one change. And yeah, give me a number. What was the number of changes you might have noticed? Three. Alicia, okay, cool. Anybody else? Three. Okay. Shelly, thank you. All right. Okay, let me go back. Let me play this again. Here we go. Ready?
Observation. The real question is, how observant were you? Action. Clearly, somebody in this room murdered Lord Smythe, who, at precisely 3:34 this afternoon, was brutally bludgeoned to death with a blunt instrument. I want each of you to tell me your whereabouts at precisely the time that this dastardly deed took place.
I was polishing the brass in the master bedroom.
I was buttering his lordship's scones below stairs, sir.
But I was planting my petunias in the potting shed.
Constable, arrest Lady Smythe.
All right. There were 21 changes in that scene. What's the point? You can't see what you're not looking for. And so you can't see what you're not looking for. And I sort of leave you with that in really in kind of thinking about how we view the work that we do, how we view our older adults, how we view the value, how we can be creative and imaginative in changing the perspectives that we have, knowing where you're coming from and where you're entering the work and how that impacts the outcomes of the work, the programs that we're implementing across all our programs. But in particular, I think we're in a sort of a unique, I think in some ways, position with older adult communities because we still have a narrative that I think deeply affects the ways in which we treat them, respond to them, and the effects that it has on their health and well-being at the end of the day. And so I think one of the things I always leave folks with is this idea of what do we keep ourselves a safe distance from? What do we kind of keep in ourselves a safe distance from that we don't have to look at differently or understand differently or think about differently? And so I would ask you to think about the same thing as it relates to our older adult community members and the work that's being done with our community members, particularly our older adult community members. What are we keeping ourselves a safe distance from that we might not be able to see that might be impacting the outcomes that we have? the access, the success, and how can we begin to do things differently. So we need to continue to obviously think about creative and imaginative ways to increase social activity for older adults, increase access to mental health services, increase family connection, increase the sense of community resources that address language barriers, all the things that I think you're doing in the programs already. So I leave you with that as something to think about. I always end with this particular greeting. It's an ancient Mayan greeting. I was gifted this about 15 years ago from some indigenous community workers that I was doing a workshop with up in Northern California. And they introduced me to this, and I asked if I could continue to use it, and they said yes. It's called In La Kesha Lakin. You are my other me. If I do harm to you, I do harm to myself. If I love and respect you, I love and respect myself. So I hope we can remember that sort of shared humanity and our process as we think about our older adult communities who are valuable, as many of you know from your own communities and the work that you're doing. So thank you for showing up and for sticking around. I will stop sharing now. I think there's a few minutes for Q&A, maybe 4 minutes, 5 minutes. So
Anybody feel free to hop off a mute and ask a question.
or comment, it's fine.
We don't have any. I just want to say thank you, Dr. Gallardo, for coming and giving us this talk. I know you may know recently we just fought real hard to get ISOA renewed again. Yeah, so it's a really refreshing thing to hear you speak and and get us all fired up for another couple of years of this
Okay.
and serving our older adults.
Yeah, I think what I would say is be creative, be imaginative. The funders, I know the funders well, and I think there's limitations, and so advocate for yourselves to do the work that you think is incredible and important for your communities. And also be aware that even though many of us and all of us, it looks like most of us, all of us are folks of color, we are still breathing the air of the isms of the world, and it impacts us. So just because we're folks of color doesn't mean we don't come with our own biases and internalized isms, whether it's racism, ageism, classism, sexism, whatever it might be. And just know it impacts us. It impacts us, and it impacts even your connection with each other as colleagues as you do the work. And so start in-house with each other, and then it will flourish from there in many ways. So I've always said that my greatest commitment to Mecca is to the staff who work in the agencies, the community members who come and work in the agencies, because you're truly the heart and soul of the work that's being done, and really the reason that Mecca has been so successful. So hopefully you're valued and you're appreciated, and you're recognized for the contributions and your knowledge and wisdom that you bring. Knowledge and wisdom doesn't come with letters and degrees behind your name. I think that's another sort of problem we have in our society. We think people who have doctorate degrees and all these other kind of things are the ones that sometimes know all the answers, and those of us from many communities of color know that simply isn't the case. And I always tell folks, like, what my grandmother says and my parents say works. Like, I don't need evidence-based randomized clinical trials and research to demonstrate the effectiveness of those things. It's in our cultural wisdoms. We've inherited. We talk a lot about how we've inherited sort of challenges and traumas, but we've also inherited a lot of wisdom and strength and resilience. And so we owe it to ourselves and to the next generation of folks to sort of do something with that, the strengths and the resilience and the wisdom as well, and the knowledge. So you all have it with you, all carry it with you. And remember, rest is resistance. Rest is resistance. Don't get caught up in the colonial system of needing to always prove yourself because we were told that, we needed to do that to sort of have value and worth. There's value and worth in our presence and in our existence, and rest is resistance. So find a rhythm somewhere in all this to take care of yourselves. Okay. All right. Thank you. Thank you. Keep up the great work. Shelley, Matt, let me know what else you need.
Thank you.
All right, thank you guys. Have a good one.
Thank
Thank
you
you
so
everybody for coming.
much. Bye.
Thanks. Okay. Thank you.